Welcome back to the Pat and Aaron Show. It is time for the Pat and Aaron Show Injury Report, presented by Florida Orthopaedic Institute in partnership with Tampa General Hospital. And joining us today on the hotline, none other than Dr. Seth Gasser. We've had him on plenty of times, and we love talking to him. Maybe the last time we'll be talking to Dr. Gasser for this season, as the season is coming to a close. And Dr. Gasser, we got the championship games, and Deebo Samuel, big injury for the 49ers, went down in that game last week. They were able to overcome it, but they're going to need him if they want to overcome a team like the Lions and get to the Super Bowl. His status is up in the air. Now, Dr. Gasser, he injured the same shoulder earlier in the season. So how do you think the earlier injury impacted what we saw last week?
Well, it's hard to say, but it certainly could impact what we saw. If he was playing with some pain throughout the rest of the season and never completely healed, certainly possible he re-aggravated an old injury, which might make it harder or take longer to recover from. Of course, as we get into the playoffs, they get a little nebulous and aren't quite upfront of releasing lots of information. So they basically just said he didn't fracture his shoulder, but that doesn't really tell us a whole lot about what he might have done.
How do you know when it's the right time for a receiver to take a game off? Like, if it's not a fracture, right? Is it just about mobility within the arm? Because I know a lot of times, right, when people have shoulder injuries, they can't get their arms up, and that could be very difficult if you're trying to catch a football, right?
That is a great question, because that is the question that we get for most athletes, depending on any injury that they may have. And so, athletes are lucky they have specialists to help them recover. And typically, you go through a process where you have an injury and it's painful, and you have a short period of relative rest, and then they go back to early protected motion, followed by gradual strengthening. And then there's this graduated return to sport activity in which they're monitored. And really, in order from a physician standpoint for an athlete to return to play, let's say for a shoulder injury, they have to demonstrate normal motion, a stable joint, good strength, minimal pain, and then they really have to demonstrate the ability to perform those activities on the field that are required for their sport and position and do it effectively. And if they can do all those things and they have something that's not at significant risk for permanent injury, we'll let them go back and play. And those are the steps we sort of go through for every athlete and every injury. And those guys are lucky to have professional trainers working with them daily. And I think Tampa Bay is lucky is that we have great groups of trainers and therapists in the community to help the average Joe and not a professional athlete as well.
You mentioned permanent injury. Aaron's actually never heard this, but I got hit by a car when I was younger.
Yeah,
and
that's news to me.
My shoulder has bothered me ever since. It's a problem to this day. Are there specific injuries that, within the shoulder that are long-term or lifelong injuries versus other ones that can heal up relatively quickly or go away? Because, again, I was like 19, 20 in that range. I'm 46. I've had shoulder pain my entire life since I got hit.
So most of the simple fractures are good injuries because bone is one of the few tissues in the body that heals with bone and normal bone. But when you have a soft tissue injury, oftentimes they heal with scar and not normal soft tissue. So if you have a significant injury and you get a lot of scarring, you can have permanent pain and some limitations in whatever joint that may be.
Frank Ragnow of the Lions was very annoying to me last week, Dr. Gasser. I know it sounds like I'm a horrible human being, but whatever. He sprained his knee and his ankle against the Buccaneers, but this guy just kept crawling back onto the field and being effective. And every time he went down, I'm like, there's no way Ragnow's getting back on the field. That bastard got back on the field every single time. Good for him, but how's he going to be? He took such a beating. How does a guy like that, I know they're monsters in the NFL, Dr. Gasser, but how did he return so quickly?
So based on the injury film, it looks like he probably had an ankle sprain and maybe an MCL sprain of his knee. If you're going to pick two injuries for the knee and the ankle that you could play with, those would be the two. And then the ability to play is really based on the severity of those ligament sprains. If they're relatively mild, they'll be painful, but the joints will be stable and still able to perform those things he needs to do. And if you saw his post-game conference, that guy is one tough SOB, and I don't think much would have taken him out of that game.
Speaking of tough SOBs, Mark Andrews had a cracked fibula and an ankle ligament injury against the Bengals in November. He's probably, it sounds like, going to be back on Sunday to play in the AFC Championship game. How unbelievable is that recovery, and how do you think he was able to make it back as quickly as it looks like he's going to?
Well, I think probably the cracked fibula was good because that probably is healed in 2 months.
It doesn't sound good.
Bone can heal pretty quick. But sometimes it's better than a bad ankle sprain where the ligaments can take sometimes much longer to heal. So we've talked about high and low ankle sprains, and most high ankle sprain guys, they can be out for an extended period of time. So I suspect he had a little crack in the bone, and bone already healed, so that's stable and shouldn't be pain-free. And they've rehabbed him for just a low ankle sprain, and actually, I think he's been full participation this week, and he's a big part of their offense, and it's likely he'll play at least a good portion of this game.
Selfish question, got to do it, Dr. Gasser, on the way out. I feel like I'm a year of laptop use away from arthritis in my hand, full-blown arthritis. I don't know what to do about it.
Well, you're probably not having full-blown arthritis. It could be more overuse injury like tendonitis or something else if you're on your laptop a long time.
What about carpal tunnel?
Yeah, I might have the tunnel.
Yeah. Well, carpal tunnel typically presents with some pain and numbness in your index finger and your thumb. So if you're getting some numbness there, it certainly could be carpal tunnel based on the position of your keyboard and the height of your desk.
Yeah, I occasionally I'll get pain. I'm about a week, maybe 2 weeks away from giving you all a call and scheduling an appointment because I'm almost there. Listen, no, this is real. People deal with this. Doctor, you know what I'm talking about. People probably deal with this all the time, especially in the new age of laptops and other things.
It's unbelievably common because of that, yes.
See?
And easily corrected sometimes with just some adjustments in your workstation, believe it or not.
No doubt about it, and easily corrected and easily repaired when you go see our friends at the Florida Orthopaedic Institute in partnership with Tampa General Hospital, providing you access to one of the top orthopedic programs in the nation. We love having our doctors on like Dr. Gasser every single week, not only to talk about the injuries that the NFL players are dealing with, but they may relate to you. Or if you're dealing with a potential carpal tunnel or dealing with hand injuries, whatever, they have a doctor for you at Florida Orthopaedic Institute. Schedule that appointment today, floridaortho.com. Dr. Gasser, we love having you on, and if we don't talk to you again for the rest of the season, thanks so much for everything you've done for the show.
Yeah, thanks, guys. Always a pleasure.
Thanks, Dr. Gasser.
That's floridaortho.com. Dr. Gasser, one of the best.